I always think like the companies that will produce long-term value, reinvest, like do the right thing for their client base, like that's what truly like most important.
Welcome to Self-Funded with Spencer, sponsored by Pareto Health, ClaimDoc, and PlanSight. Whether we're discussing innovative new healthcare strategies, exposing hidden revenue streams or misaligned incentives, or even just cheering on the next generation of this industry, we promise you that you're going to learn something. So thank you for joining us for another great conversation about the future of healthcare. I'm sitting down with Dan Cochran at Cochran Health Ventures.
Cochran Health Ventures.
Yeah, awesome, man. Well, thanks for coming in from the Pacific Northwest, man.
Yep. Great flight. Great team
Easy.
here. Yeah. Easy.
Good, man. I'm glad. I always, again, I'm grateful. Like, it's one of those things that you asked me the first episode of the podcast and what it was like. I don't think I ever envisioned, we're almost up to, I think, 200 episodes shot. I wouldn't envision people would fly in and be on a podcast. So I'm very grateful for you doing that, man.
Well, I'm grateful to be here.
Yeah, cool. Well, we got to have a chance to get to know each other. We're going to do a pretty cool think tank after this, which I think we're both excited about. But real quick, Dan, why don't you just position in your mind what you envision today's podcast is going to be about?
Yeah, I mean, I obviously want it to be, valuable to you and all of your viewers. I think I have like a pretty unique sort of view on healthcare. Okay. Starting, selling to hospitals, then coming over to the payer side. So if anything, more educational. And one of the things I was thinking about on the way in here is like healthcare is just this beast, right? Yeah. Like it's very complex, it's expensive. I'd say your like average consumer probably doesn't understand it. And there's some things, within the company that I'm representing, Quantify Specialty Care, that I definitely want to, touch on that I think will be valuable. But in general, I just want it to be eye-opening, educational.
I think it will be. Yeah, based on what we've covered so far over coffee, man. And you say your average person or consumer doesn't understand healthcare. I would actually argue your average employee benefits professional doesn't fully understand healthcare. And I might even lump myself into that.
Totally.
Because I only really focus on the risk financing side and stop loss insurance. And I've had the last couple of years that opened up to the delivery side and the whole system. I still feel like I'm pulling on the thread on a sweater and it's all unraveling before my eyes. So that's really cool. I think that's a great positioning. Obviously, Infusion will be a specific area that we talk about. But let's get to know you real quick, Dan, and your background. You mentioned both Quantify and Cochran Health Ventures, so we'll talk about your CV. But where'd you grow up? Like, what'd you study in school? All that cool stuff, man.
Yeah, so I grew up in Lake Oswego, Oregon.
Say that again? What is
Lake
it?
Oswego,
Lake
Oregon.
Oswego, okay.
Yeah, I know, hard to say. And, it's funny because, like, it's probably a good thing to touch on. Like, I had a unique sort of entry into healthcare. So my dad was part of like a few different healthcare companies, ultimately started his own healthcare company. And it was one of those things where he would like dress me up in a suit, take me to his meetings and like, don't say anything, but, sit here and observe. So
that's cool.
I was always like exposed to things at like a very, early age. But his whole thing was like healthcare is recession proof. Like it's a great, area for you to, focus. So I think that was sort of growing up. I always wanted to be.
How young were you when one of these first ventures?
Probably 5, 6.
Whoa,
I have a photo. I literally will
teenager,
show.
okay.
Like, after this, I'll show you a photo. Maybe we can put it on like the podcast promo. But through high school, like I was always kind of watching him grow his business, which he was more selling to private practice physicians, which sort of a dying breed with like all the consolidation. But a lot of his relationships, were with providers.
Yeah.
And, it was just great to kind of, watch. But through high school, I was always out on the Lake Oswego, and I always wanted to work for like a boat company. So my first job, which was sort of a summer job outside of sports, I worked for Mastercraft. It was Portland Ski Boat Center. And we did great there. So I like started boat washing, got into sales, and then 2008 hit. And it was like, well, we can't sell the boats that we bought because of the, economy and everything. And that was sort of my first eye-opening where it's like, I need to have, a real job, right? So
there's that concept of recession-proof, right, that your dad mentioned.
That's exactly right.
Yeah, boat sales is not recession-proof.
People were not buying $100,000 boats at that point. So, I got my first job. I was selling a product called GE Centricity. So it was a practice management electronic health record solution. our big competitor was Epic. We actually did quite well selling against them, more because we were built for like the private sector. So, small group size or, 50 and above, but we weren't selling to like hospitals at that time.
Okay.
And I was there for almost, I would say 6 years, primarily selling in like the Pacific Northwest. But what happened was like all of my clients were getting acquired by the hospital. So there was this huge shift to, get this doctor to work for the hospital, private practice goes away. So I knew I wanted to sell into hospitals.
Makes sense.
And one of the most like eye-opening career experiences, I was working for a company called Global Healthcare Exchange. So it's GHX, but that was my transition from private practice to selling to hospitals.
Okay.
And, it was fascinating to me. So this guy, Mike Bishop, who was the head of sales at the time, and, one of my close mentors still to this day, but he's like, Dan, like, if you can do well in healthcare supply chain, like you can do well anywhere. Like this is going to be the hardest thing that you're ever going to have to learn. And like anything with sports, whatever, like I always wanted to like understand what I'm selling and like get into the detail. And I learned it. I was there for, I would say 4.5, 5 years. But selling to hospitals is really hard. Like procurement, they'll negotiate you down to the penny on like anything you're doing, regardless of how much money you're going to potentially save them. And one of my relationships with a private equity firm, Fraser Healthcare, he's like, Dan, you should probably get into like the payer space. Like there's a lot of like really innovative companies going on in that space that you would enjoy. And so they made an introduction to a company called Macro Health. And this was about 6 months ago. I was still there. I do some advisement work for them. But that was my first entry into the payer market. And I think I was telling you at coffee, like it was difficult for me because I was always advocating at that point for the hospital, for the providers. Yeah. And I saw that world of like, what it's like negotiating with insurance companies and getting, their best preferred rates, right? And when I came over to Macro, which was all about saving health plans money, I realized like the egregious marking up of bills and, what was going on from, a cost perspective. So it sort of gave me this like really unique perspective of both landscapes, provider and payer. I think we both agree, like it would be wonderful if they would just work better together.
Yeah, exactly. It's a very adversarial seeming relationship. A couple things I want to talk about. Yeah. Or maybe just mention, it sounds like the recurring theme of each one of those steps, you had great mentorship. So you had your father, you had the gentleman whose last name was Bishop, and then you came into Macro. People were kind of helping steer you in the right direction over time. Do you, were you seeking out mentorship, or obviously with your father, that's different, but did it naturally just people identified you as a talented young person and they wanted to help, or what?
Yeah, I think like a combination of both, but like when I talk to younger people, like I have one of my kids I used to coach lacrosse for in like 5th and 6th grade, Bodie Maurer, there's a shout out to him, but he had a great season at Towson. He wants to get into healthcare, and he called me and he's like, what is it all about? And one of the biggest things that I told him is like, you need to find good people around you. And mentorship, like I couldn't tell you how important that has been. I think it all happened naturally. A great example, so there's a gentleman, Nader Nini, he's part of Fraser Healthcare, and we were golfing one day at this Overlake Golf and Country Club, and like hadn't met him before. It's the member, and he's like, what do you do? And I'm like, oh, I'm working for GE Healthcare and I sell GE Centricity. And he's like, well, funny, I'm flying out to Wisconsin, and that's one of the companies that are divesting. And, long story short, like we all got intertwined. And ever since that moment of like meeting him, we've just stayed so close. That's and cool. For young people, it's really important to see like what goes into it. And I think a lot of these like high performing people that I was sort of trying to learn from, I understood like the discipline. Like you have to know what you're selling and then what your purpose is, to be effective. And then the other part of it is like the people you sell to, you have to maintain such a strong relationship with. And I would not be successful if like the majority of my clients didn't become my close friends. And I'm talking about like staying at my house or, we go to weddings or, God forbid, a funeral. But it's like these people around me understood that I wasn't there to meet quota or make a commission check. It was really listening and understanding, like, how do I provide value to you?
Yeah.
And
Pareto Health is the largest benefits captive in the United States. With nearly 3,000 captive members, 1.3 billion of stop-loss premium in force, and almost 1 million covered lives, no other benefits captive comes close to Pareto Health's scale. But it's not just about the numbers. Pareto Health is a mission-driven organization, and that mission has two distinct parts. Number one, to make self-insurance simple and more accessible for small to mid-sized employers. And number two, to arm them with the most powerful cost management tools on the market. So if you're an employer frustrated with your healthcare outcomes, or you're a benefits consultant looking for an alternative to the status quo, it's time to consider Pareto Health. Pareto Health, where employers come to do self-insurance right, to do it easily, and to do it at scale.
For sure. If you truly solve people's problems, like that's what sales at the end of the day is really. It's not just about convincing or persuading somebody. It's like understanding their need and delivering on that solution.
For sure.
The other thing, like you mentioned, relationships and network. I mean, that's going to be something that is, those are timeless things, right? Totally. You will never not need to be able to build relationships, and the bigger and deeper your network is, the more successful you're going to be. And those are true regardless of what time frame we're talking about. And I mean, that's just great feedback for anybody that's younger that's listening to this, and I would agree with it. And those are things that I uncovered on my own. One thing I mentioned, there's two things I was going to talk to you about. The other thing is, I think you have the fortunate benefit of sitting on both sides of the table. I've had the ability to do that as well. And I think by sitting in both seats, a buyer and a seller side, you better understand the equation. If you only see it from one side, you won't understand the other half of it. And now, like I was telling you earlier, I'm getting introduced to the delivery side and the hospital side and inside service, right? And those things that I haven't really gotten privy to in the past. And like, it's just opening up a whole new world to me. And so I do think, like, from a career perspective, having that diversity of your vantage point just makes you better all around.
Totally. Yeah, it's the knowledge of it. And like, one more thing on the mentor piece, like, I think successful people want to help other people. Like,
of course.
I've learned that.
Of course.
Like, people should not be shy to just be like, hey, let's have a coffee, and then switching back to like what you'd mentioned about like payer provider, I used the AI sort of analogy this morning, but it's like hospitals are investing how to make more money. Like, I shouldn't say like they want to figure out how to upcharge, as best as possible, but make their bills more defensible, and they're investing in technology to do it. But on the payer side, they're trying to break down the bill and invest in AI and machine learning to understand, like, should we be paying the hospital what they're asking to be paid for? And it's this constant game of like cat and mouse, right? And it's, I think it's ultimately sad, right? Because so much of the foundation of healthcare comes down to a contract, right? Mm-hmm. So if you're on the payer side, you seek care, there's some medical agreement of like, this is what I'm going to pay for this service, right? And you have both sides of it. But if the hospital knows, like, okay, if this member from so-and-so payer comes to me, they have this payment integrity solution, they're going to mark it down 20%. So upon renewal for that contract, I'm going to try to get 40% higher because I know it's going to come down 20.
Right.
It's like the game never ends.
It's a cat and mouse.
It is. But that's like the constant.
Well, then the member is the conduit for that transaction to be possible, and for the the wealth, if you will, or the money to be extracted, right? Like that's so that they have to be at the center of it. These two sides fight over it to maximize the outcome for themselves. Employer and or member, it gets extracted from their pocket at that point. It's a really sad way that it's designed.
It is, yeah.
And then we could spend a whole podcast talking, lamenting on how terrible that is. But I think solutions focus is really what I like to do on this podcast. So before we move on to what you do today, what did Macro do? I don't think I heard you say exactly what Macro was doing.
Yeah, so we essentially had a marketplace for primarily like medical networks and out-of-network solutions. And our primary audience, at least at the time, were regional health plans or provider-sponsored health plans.
Okay.
And we were more focused on either travel membership or members that resided outside of a health plan's like proprietary footprint. So a good example, and one that I can share, is Providence Health Plan. Their proprietary network was Oregon and Southwest Washington. And then as members traveled out or lived outside of Oregon and Southwest Washington, they were using, First Health or First Choice Health Network. Okay. And so we essentially have a data-driven approach through the marketplace to identify what's the most favorable medical network that they should be using for those members to get the best discount, right? So all of what we did was providing back, from a data-driven approach to say, you move from, A network to B, you're going to save this amount of money. And then here's the operational roadmap to make that happen. Because every medical network, they have different operational rules, different requirements, some contract, some operational, but, it really is like a heart transplant, changing, a medical network. But when it can save you 40, 50, $60 million a year, there's a big, incentive, to do that. And then ultimately so that was like how we started, was really medical networks, out-of-network partners. And then we were starting to add in other sort of value-based partners. So different benefits to that marketplace that the same clients could then, benefit from. And I'd say a lot of it was like, how do we reduce the overall cost of healthcare? That was the mission. And I would say, we definitely did that. And it was a great company for me to be a part of, mainly because I was the first commercial employee, and it was like, here's the idea, go do it.
Yeah.
And, I don't know
Those
how
are fun. Yeah,
it was fun. The building of anything is what I love the most. So
that's cool. Well, so then let's get into the building, right, of Cochran Health Ventures. And, I know specifically we're going to talk about Quantify Specialty. But was there an idea at some point, or had you always had the idea that you kind of wanted to be out on your own eventually?
Yeah, I mean, I think part of that comes back to my dad. Yeah. So I don't know, early on into my career, it's like, when are you going to start your own company? When are you going to start your own company? So, and I wouldn't call it pressure, because it's like I put enough pressure on myself, but it was something I always wanted to do. But his whole advice for me was save your money and then wait for the right opportunity. So I was saving my money, waiting for the right opportunity. And, I would say early stage, I felt like I had to have an idea for a digital health company and build and do all this stuff. And that was sort of I had to have the idea. And that was what was ultimately holding me back. But what I realized is I have so many unique relationships with different companies that do amazing things, that I don't have to be the creator of that technology to provide value. And I can fit myself into other companies that I believe in, regardless of how that's structured, if it's equity or performance-based, whatever it may be. So ultimately, the idea around Cochran Health Ventures was, I want to be an independent. I want to help the companies that I know can provide value to the clients that I serve, and then, do that focus. And so, I didn't want to lose my relationship with, macro health by, going out. And so I was trying to put myself in this way where I could advise and then be part of this great new company, which we'll talk a little bit about, Quantify Specialty Care, which was really the start. It was really 2 organizations that I was, helping. And then since then, there's probably 6 or 7 very specific companies that I feel like can provide value across the landscape of self-funded employers, TPAs, or health plans. So,
it's interesting to hear your transition, because everybody's transition into entrepreneurship seems to be different. And it would be the question, what came first, the chicken or the eggs? Did you have clients lined up before you moved over, or you just took the leap of faith and then go found clients? But it sounds like you had at least planned for it in advance by saving up money from your father's urging. And then therefore also you had a special relationship with macro that allowed you to exit and still stay involved, and I assume have some income associated with it. And then obviously venture out from there. But there is something interesting about the liberation of taking yourself away from just a solo logo that you represent, to free you up to represent a bunch of companies you're passionate about, but maybe in a fractional way as well. So I'd love to hear kind of the thought process there.
Yeah, I mean, I think, so have you ever read the book One Thing by chance?
I don't think so.
Okay,
I mean, I haven't read it. I don't even think I've heard of it. Yeah.
Yeah. So I mean, and this kind of goes back to the vulnerability side, but, I don't know, being in sales, it can be stressful, right? You got quotas, you got stuff that you got to deliver to people. Sometimes you're waiting on somebody within your company to then deliver to somebody, and there's all this chaos, right? And it wasn't that I had like a hard time managing it, but it was like I needed like clarity, right? And so I read this book, One Thing, and it basically, proves that, to be high performing at anything, you can really only be focusing on one thing. And it almost helps you be okay with the chaos. And so at Macro, like when I first started, so there's like a framework in the book, and David Angeloni, who's one of the co-founders of Macro, I like sat him down and I was like, this is what I'm going to do in 10 years. This is what I'm going to do in 5 years. This is what I'm going to do in, 1 year. This is what I'm going to do in the next 6 months, month. Every week I'm going to do this. Every day I'm going to do this. And I had this just like super laser focused process over like this 5-year period. And it, brought me tons of success. But what I realized is that I had the blinders on. Like there was so many other things going on in healthcare that I had passion about. And, I think saving people money is very important, but, and one of the things about the Quantify specialty care that I just love is we're saving people money, but we're doing something very important for members, right? Yeah. And so that balance was something that I wanted to find, and I could do that through other companies that I saw doing amazing things. And I didn't have to be part of one individual logo. And what I didn't realize is like, as soon as I made the announcement, like I'm starting Cochran Health Ventures, this is what I want to do. Both client and digital health, like companies were reaching out being like, well, this is awesome. Like, what do you see? And if it's the client, like I'm having these problems, like find a solution that can do these. And then the companies, like a lot of them have been very successful at like one thing, but they don't know how to enter into like other new markets, right? And so the pricing, packaging, and essentially like pitching of these companies is what like I understood how to do. And part of it is like doing it in a data-driven approach, but understanding like what they need to hear in order to make sense that like this is a valuable solution to plug into my ecosystem, and I need to do this because, there's so many digital health companies out there. It's hard to know what's the right one, who's better than who. Like, briefly, just like the best example I can say is like out-of-network solutions, right? There's like amazing companies like Valence and Zealous and Clear Health and like you name it. And, buyers get intimidated. It's like, okay, well, I did the cost savings analysis. They're all roughly around like 70% of savings. They have a low appeal rate. Like, how do I decide? And it's just difficult when there's so many.
Well, it's a noisy marketplace. You and I were talking as we were walking up here. It's like, the amount of noise that I see just simply based on my position at Pareto and then the podcast, right? And I think a lot of people want to talk to me for one or both of those reasons, but it's like I'm inundated with people that want to present their amazing thing. And it may be amazing, and I take some of those calls, and then a few of them I filter out to go up to Pareto or filter to the podcast because I'm interested. But I can imagine being in the actual buyer's position trying to filter through that, because then they have to choose and then live with that decision. I simply get to talk about it on a podcast, right? So that's a lot of pressure to try to figure out what is the best thing in millions of categories of things, right? So do you have any best advice of like how you identify ones that are really onto something?
Yeah, like I think one, you have to have really smart people around you. And so I'll tell like 2 stories, one really funny, one kind of not, but I'll start with the funny one. So, and this is like, to also shed light into the power and the uniqueness of being on the risk side. So reinsurance, stop loss carriers, and captives, in kind of like how you probably feel a little bit of pressure to come to the table with the best solution, but you have a lot of power in doing so. Like if Pareto gets behind a product, like that's a really good thing for that solution, right? So everyone's trying to get your attention. And so on the reinsurance side, there's a gentleman, Dave Kalb, who he's at Risk Strategies. Become really close with him over the years. And, Macro, we were past the idea stage, but we were still like, trying to break it, like, I would say like hit our stride. And I was on a phone call with a health plan I won't mention. He was on the meeting from like being their reinsurer broker. And he's like, hey, Dan, can you hang back for like 5 minutes after the meeting? So I call him direct, and he's like, so I like love what you just described. He's like, I have a very unique health plan that I think will be, valuable for you to speak with, but it's not the typical health plan that I would, refer somebody to without knowing more, but it's just this is kind of what they need. So I'm like, I'm going to make this introduction, but if you F this up, like this will be the last time we will ever talk. And I'm telling you, like, word for word, minus the bleep is like what he said to me. And I was like, oh my God, like this is intense, you know? So like, and obviously we did very well, like in that meeting, they ended up, you know, becoming a client. But I think that level of like understanding that like you have to deliver what you're pitching. Like you can't just sell like a you know, PowerPoint, right? Like it has to create value. And then I think the numbers are very important, especially on the payer side, is like, what is the impact? And regardless of like true intent, whether it's like mental health or whatever it may be, if there isn't some way to either make the, you know, payer money or save them money, they typically won't move forward because they're just unfortunately too busy. Like it isn't that they don't want to, you know, and there's ways to kind of like create a financial model that will help people like make sense of that. The second story, so one of the mentors, I think I mentioned him before, but Brad Garrigus, so he's the chief sales marketing officer of Providence Health Plan. They're a previous client of mine. He's a pretty unique guy. Like he has obviously sales, but he has underwriting, network, product, like the whole health plan sort of like operates under his, you know, purview. And he's been there 15 years. So that's like, he knows the plan super, super well. And I've developed like a very close relationship with him. And so when I see or hear things that I feel like can be valuable, he's one of the first people that I pick the phone up and I'm like, how would you think about this? Like, one, yes or no, is this interesting? Two, how would this fit in? And like, what would the path be? And it's not to sell him and like figure out like, can I get this into, you know, Providence Health Plan? But it's more him guiding me on what companies can truly make an impact. Because you've all seen the companies that like the idea is brilliant and it's great, but they can't ever build traction because something doesn't make sense or like they have not figured out how to make that, you know. Well,
you mentioned blind spots earlier. A lot of the early stage companies have blind spots.
Totally.
Like they believe so strongly in the original vision. The market keeps telling them over and over again, something's not working and they just don't see it. Yeah.
For sure. Yeah. So you just kind of need like people around you that, you know, have used it. I know references are old school, but like I'm the first one. Like if you're going to buy something, like talk to somebody using it. And if the company doesn't have like 2 or 3 people that are just going to be like, yes, I deal with Dan. What he brought to me was great. Like green light, like do it. You know, like you should have no problems doing it. Like that stuff's important to me because you want the community.
Well, right? You want the community. You mentioned network earlier. It is good to have a good reference network that you can bounce ideas off of. I'll sometimes get really excited around the narrative of a solution that sounds amazing. And I'm like, yes. But then I'll pitch it to a couple confidants that I have and they go, well,
this
actually,
problem, that problem.
Yeah, like, and you get a balanced perspective because I tend to sometimes get enthusiastic of the superficial presentation and stuff because it does make sense conceptually, and then I don't really think about like I should have scrutinized this more because I'm not consuming it. I'm not looking to buy or use it, so I don't take it to the level of scrutiny it needs. And then sometimes you need somebody with 30 years of experience in that space to tell you why they didn't think about X, Y, Z. And you go, okay, all right, that's a little bit more fair way to look at it. But I think what'll happen then is like in the situations where the idea is great or maybe the presentation's great and you get early traction, to your point, if it doesn't actually deliver eventually on what it promises, then you're going to have a huge flash and then you're going to have a crash afterwards. Yeah.
And client retention, like you're going to lose customers. Like what you did 3 years ago has to still be valuable to you 3 years later, or you know what, you should leave them, right? Yeah. So I always think like the companies that will produce long-term value, reinvest, like do the right thing for their client base, like that's what truly like most important.
Well, that's a perfect way to summarize my original question is like how you evaluate these. But let's get into Quantify Specialty. How did they emerge? Like when did you meet Sumant? Where's the relationship come from?
Yeah, so I met Sumant through both a private equity firm and then also a gentleman, Tom Nicholson, on the East Coast. And I had heard his name. I think he had presented to Macro like at some point too. So it was sort of in this like 1 month period of time. I kept hearing like Sumant ready. Like he just kept popping up. And so ultimately, actually, he came up to Bellevue. So I had just mentioned, I'm like, hey, I'd love to sit down with you, talk through, you know, what you're doing, what I'm doing. And we basically just like hit it off. And the interesting thing, so he already had a very successful organization called Quantify Health.
Yep.
They essentially, review high dollar bills, 100 and above. They have a forensic review process better than anybody's. There's like 160 subspecialists, very effective at what they do, and a very big client base. But his whole thing was like, there's a huge opportunity in the specialty pharmacy space. I think he had a unique way to identify that there was a problem because he's reviewing claims. Many of them are specialty because they're all high dollar. And he's like, there's just this massive, egregious marking up of the bill when it doesn't cost that much to procure, this drug. So like there's a foundational problem in the way that, specialty pharmacy is handled. So ultimately I was like, well, how do you want to do it? And, they had already like made some advancements. They made a few different acquisitions to essentially build the infrastructure. And so their whole approach was like, we want a vertically integrated model. So oddly, like I think the cost problem that we solve is the easiest part, which is we essentially don't mark the bill up the way that everyone else does in the industry. And so call it cost plus or, a fair margin to run a profitable business. But the way we get paid is the margin in the drug. We're just not charging as much as anybody else. And we've been successful from a cost perspective, showing savings, even when people have like some other specialty solution that they've, procured and use. And I think it's just that we're very disciplined in the margin that we take, and we don't, go over our essential like threshold.
You're speaking to a capitalist here. There's nothing wrong with margin. I mean, that's what this entire economic system is based on, is the ability to make a profit, right? And so nobody, at least in my seat, would argue against the ability to make profit. It's always a question of, is it an appropriate amount of profit?
Right.
Are you gouging people? Are you using me to extract profit instead of just making a fair amount of money?
PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. Well, what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
I want to, if you don't mind, let's step back just for a second to go 2 steps forward. Infusion. What is that? Let's define it for the audience in case they don't know.
Yeah, so the category would be rare disease, and unfortunately, like there's just more and more people out there that have these chronic conditions, and so I would say like the category of pharmacy that we're in, and it is a true category, but specialty pharmacy, and our primary focus would be on the medical side, and then anything that's like a J or a Q code. So there's 300 plus specialty pharmacy drugs that we're sort of like laser focused on solving for people. But today you'll unfortunately you get your diagnosis, you get prior auth, then you have to go into the treatment. When you end up at a facility, there's typically a pretty egregious marking up, of that bill. And that's sort of the problem that we, at least from a financial perspective, wanted to solve. The unfortunate thing is in this space, there's other things to solve than just the cost equation. Like we feel like that is simple and we can do that very easily. But now, I would say like nurse to patient ratio has gone up significantly. It's really hard to find that like one-to-one, relationship.
Yeah.
And many of these patients, they're polypharmaceutical, polychronic, like they're complex cases, right?
Yeah.
And many of them are on life-enabling treatment. So it's really important to treat them fairly and, come up with a better care delivery model, for lack of a better word.
Care about them, right?
That's right.
I mean, the healthcare component, right, which is really the human side that often, like you said, gets lost in this equation. So why don't we just define it maybe with a specific instance? Like, what is this condition that you guys often will help treat with an infusion?
Yeah, I'll maybe do it by like drug type. But for a blood disease, there's a drug called Ultramirus. And, we see that drug anywhere from like 200 to all the way up to like 600,000 per treatment. Typically you get it, 6 times a year.
Okay.
So you're talking like millions of dollars every year.
Yeah. And what is it about the hospital setting with these J-code drugs and running it through the medical plan? What is it about that set of characteristics that really massively increases the cost?
It's a good question.
Yeah, thanks, man. I try to ask good questions occasionally. Yeah.
I mean, and the short answer is like, there's no reason, right?
Yeah.
I mean, and like, I don't know, like how all the like billing mechanics, work at those facilities. But like one of the big things that we always wanted to have part of our solution was we wanted to own the pharmacy. So we have 3 specialty pharmacies. We know what we're procuring the drug for. We know specifically what markup we're going to have and then what we're going to pass the drug, along for. So that same drug that I mentioned, Ultramirus, like we can extend it on for, like 28,000, right? So massive difference in, cost of drug.
28,000 per treatment, correct?
Per treatment.
Yeah. So, but then by, like you said, for contrast, $200,000 to $600,000 per treatment as an example.
That's exactly right.
10 to 20x plus.
Yeah. And it's not always like that egregious, but like you're like 200, 300, 400, all the way up to 1,600% we've seen like in marking up of the drug, right? So it's
I was just about to get really pissed off, but justify that for me. Why in the hell would a hospital feel it's appropriate to mark up a drug 1,600%?
What I would say, without like bashing the hospital, it's like I don't think it is justified, because if you look at like the 2 problem statements that I mentioned, you're buying the drug for a much more expensive rate. You're not getting 1-to-1. When you leave the hospital, like it typically is going to take you like 2 weeks to like get your, release documents and communication with the provider, and you can't just like call them up. So those are all the things that we're trying to solve, is we want everything to be 1-to-1. We have pre and post infusion monitoring. We have a 24/7 nurse resource line that they can communicate with. And it was just so important for us to have this, like, I know it's overused in healthcare, but like holistic approach, vertically integrated approach for that member. And, a lot of people, they don't want to be where other sick people are, right? So they don't even know that there's an in-home option available for them. They think they always have to go to, the hospital, schedule it. Maybe they're rural, they have to drive 4 hours. Like, there's a lot of problems,
Well, not to mention risk of like hospital-acquired infections while you're there.
That's exactly right.
Yeah. I wouldn't necessarily want to voluntarily go to that environment if I had an option to do it elsewhere. So if not just the home, are there other settings that the infusion can happen that's still saving money? Yeah,
so like the acquisition part of like the forming of Quantify Specialty Care, one part of it was the pharmacies that I mentioned. The other part were brick and mortar facilities. So essentially 2 different acquisitions. We're up to about like 65 brick and mortar facilities across the U.S. We can build them for clients if they have enough volume that will, justify a brick and mortar. But oddly, like what we've seen, the majority of our work has been in-home infusion. So I think it's being better received as an option. And, I love our model because it's no cost, no commitment. We go full risk. So we'll basically do a historical claims analysis, show the client what will save them. And then once we agree on like the co-redirection strategy of like what members are we going to redirect from the facility, it's on us to be successful, because we don't get paid until we actually do the infusion. So we don't charge a percentage of savings, a PEPM, anything like that. Like, we are the provider with 600 clinical staff across the U.S. So it's become a very big operation, and
very big, very quickly too. Yeah. 600. Those are full-time employees essentially, or the majority of them. That's amazing. And so what you have to do is have the personnel needs to be available, because we're talking about getting to people. Right, you've got to be able to go to their homes, or if you have these 65 or so locations across the country, building a network of facilities that can deliver it. And so there's a lot of investment up front to get that infrastructure in place. But then this becomes one of those situations. It's like, well, what pushback would you get? Like, what is a member? Are they a little uncomfortable at first if somebody come into their home? Like, what are some objections that you? Yeah,
it's a great question. I would say that's like the hardest. I mean, I think there's a lot of hard things that we do, but I think the hardest thing about redirection, and probably what we get asked the most, is like, what are your success rates? And I think part of that is like the prescribing provider. I mean, it goes like one way or the other. Sometimes the prescribing provider will do like an injection in clinic. So it is his revenue that we're sort of redirecting away.
Yeah.
Other times, like they'll make the diagnosis, they'll do the prescription, but they're sending that member somewhere else to do the infusion. And so the provider is open to other ways for that member to get their treatment. So I'd say a lot of it is education and helping both the member and the provider that it's okay for them to get it in home. Like we have all the licensing compliance that we need, as part of our organization to do it better. But it comes down to, is the member, comfortable in doing so? If we get like a warm handoff from like case management or UMCM, we're about 80% successful. If we're going in cold, we're much more around like the 60, percent range. But
do you see employers incentivizing members to choose this option? With,
for sure.
Waiving of out-of-pocket costs?
Well, we feel like if we're going to save you, like on one member, let's say, it depends on what drug, but like, let's say we're going to save you, $200,000 on one member, they should have no co-responsibility. So we believe in that. We also provide like a travel benefit. But that's where like the whole partnership comes in, where it's like, help me understand your plan design. How is this going to work? What help can you provide to us to get in touch with the member? But we also want to make it as convenient as possible for them so that they're not like, okay, we have to implement this solution and it's more work, on us.
Right.
But I think the beauty behind it is like, you're typically talking about a prevalence rate of like 1% to 3% of any population, but it's the majority of the spend. And so you're dealing with like a very small amount of members that can make a very big impact from a cost perspective. And they're typically pretty well known to the plan, like these members, because they are high cost. Definitely, stop loss.
Well, and it's ongoing, right? These things
exactly
are recurring, or you said some of these drugs might even be lifetime drugs, right? So it's not like they're not known already at that point. Yeah. And so that identification becomes really important. So how easily is it for you to get those members identified in advance when you're running that analysis initially? Where are you sourcing that information from, TPA or otherwise?
Yeah, I mean, it's great because like I don't think that we knew we would grow like as fast as we would and through different channels, but whether it's the TPA, the broker, some sort of like risk organization, and there's really one of two ways. So we can do what we call like a cost savings analysis across a whole population. We have a very, simple data guide, and they'll send us the data. We'll basically compare, here's your previous paid amount, here's what you'll pay with Quantify Specialty Care. But we ask that they provide like the member details. Yeah. And so you have like group savings, member details. If it's a TPA, we'll say like, here's the group savings, then the member. So we'll categorize the cost savings to, make the most sense for whatever audience, we're presenting to. Or like, we're not opposed to submit us a case, like send us the last, UB. Let's see if it's like a great, example case that we'll do. And then the hope is like, we prove our value through an individual case, and then we grow that relationship over time. So we have more of like a formal like process, which is more, data driven, or like we'll accept whatever.
Yeah,
exactly
yeah.
Right.
Let's say, is this something that would conceivably or will or is being built into health plans themselves?
I think so. I mean, I think right now, like we have a few different like test cases. I think it's just important for us that it isn't something that's just for like the fully insured population. Like it has to be across the board, and you have to implement it because it's the right thing for the member. Yeah. And on the self-funding side, we see a lot more like urgency and commitment of like, we want to do this and do it now.
Okay.
TPAs, are great, but a lot of times like they need to ask each individual group, like, is this something you want to do? And then, on the health plan side, I think financially it makes a ton of sense on both sides, like whether it's fully insured or ASO. Yeah. It's just a matter of like,
the motivations might be slightly different though.
Sometimes, yes.
Yeah. And so like if you were thinking in terms of implementation, right? If I'm a consultant listening to this, or maybe you have some employer representatives, like what does an implementation for a program look like? Do I need to change language in my plan document? Do I need to see if my network will allow it to carve out? Like give me some of those brass tacks stuff.
Yeah, I mean, it really depends on like what the chassis of the like payer is and like what their network, situation is. But from the cost savings analysis, we'll typically identify where they can see the low hanging fruit. And we'll usually do what I call like a phased implementation. Like, let's focus on your 20 most egregious markups. Let's, get those out of the way, go on to the next 20. And we're doing all that work. Once the member, redirects, like they're a quantified specialty care client, everything's, off and running. From a plan design perspective, it's really interesting you mentioned that. And we get this question a ton is like, can we make it mandatory, whether it's like specific therapies or specific drugs? We feel like it needs to be an opt-in program where members have the choice. Like they can always say no. That being said, we've had a lot of clients that will say upon 1/1/25, we might have some like mandatory language in plan design that's like, if you have this disease or you take this medication, you're going to quantify specialty care. But that's not really our philosophy. It's more the client.
I think with the right incentives and the right communication strategy so these people are aware, the mandating isn't necessary. It didn't even have to feel like a punishment. I think at worst, their options are do this and it's better experience and it's a lower cost and we waive your out of pocket. Don't do this. You go over here, costs a lot more money and you have an out of pocket exposure. Okay, well, if they choose that, then I mean, I would presume the majority don't choose that. I guess would be my point, right, with the right incentive structure in place. But I think even it's just, it comes back to, I was talking a lot with my colleagues yesterday. Most of the problems that we perceive are a lack of awareness that problem exists, that there's an other option that's even out there to solve for. So awareness is kind of that very first step. So people know, oh, I can do infusion in my home and it's way less expensive and it's a 1-to-1 ratio of nurse and it's friendly and there's follow-up care. I didn't know that, right? And then they would be obviously intrigued by that proposition.
Yeah. Well, I think that's like stepping away from, the infusion space just in general, like, and I don't think it's at any fault to any person because like life is chaotic. There's always something going on. Like we have kids, family, like the whole thing, right? But your average consumer, it goes back to what I said in the beginning. Like they don't understand like the beast of healthcare and like everything that goes into it, what their options are. Is this a fair price? Is this not? And there's some, unique things coming out with like price transparency that I hope will just like create a wave. Like, I think the best thing that Mark Cuban did like was just create awareness that like this was going 100%. On. Like people who never knew that this was going on, they're like, wait, like why is pharmacy so expensive? And this, and it's like, you just need more people to get people involved in their care. And the unfortunate thing is, in a lot of ways, like it's on that person to, want to understand it more. And I feel like if you do have a rare disease, like this is just my personal opinion, it's like you should really understand what all your options are. It's like this is a totally different thing. But my dad, he's a big pickleball, player and is great at playing, but he tore his meniscus. And it's funny because he was, he basically just like went in, got diagnosed, went to an orthopedic, and he's like, okay, gonna get surgery with this guy. And then luckily, like I knew somebody who had used that provider, and I'm like, maybe you should get like a second opinion. So we started shopping around, and ultimately the other provider was like, I can do your surgery, and I'll do it great, but like I think you're better off doing rehab, and like let's double down on PT, let's get you back. And he had a way better experience, but he could have just followed down that path. And is that really what he should have done? And
well, that's actually a great segue. Is a question I didn't ask earlier, but I want to come back to. We talk about unit cost of care, lowering down the unit cost or lowering the delivery of the care. What about the question of appropriateness of care in the first place? Are there situations where you identify a condition and a medication where there may be a lower cost alternative or a pill version or even the discovery of whether or not this actually is the appropriate drug for that member? Does that happen ever?
Yeah, I mean, I would say like inside of quantified specialty care, definitely, right? Because like we want to understand, like, is this even being effective? And like we have our own provider team, nursing team, clinical team to communicate with like their prescribing provider to understand like, is this something that they should even be, taking, right? So I think that's always, really, really important. But,
Well, when you think about the potential for savings, right, that's what I'm kind of driving at is like, if you use the example of a surgery, well, maybe I can have a surgery over here and it's less expensive and there's lower complication rates and better outcomes. But does that raise the question of should you have the surgery in the first place? Like your father's example, right? So we could save a whole lot of money if we realized the surgery wasn't even indicated.
That's exactly right.
So just having that second set of an opinion, but the opinion that can be objective in nature, that doesn't have a financial incentive to drive them towards a surgery. I think that's a question that needs to be raised a lot more often than it often is.
Totally. Well, and like a different topic, and like we don't do cell gene therapy, but you know, if you look at the stats and like effectiveness of some of these, you know, cell gene therapies, like it's not like 90% of them are getting better, right? But they're millions and millions of dollars. But then you bring in the emotional side. It's like, you know, I think about it with my wife or my kids. Like if they're sick, I'm going to do anything I can possibly do to get them better. And, you know, so the family's like, I want this treatment. But then if it's only 10% successful and it's $4 million, like, is that something that you really should be doing? And I don't know that those are like conversations we're trying to have. Part of it is like, you know, fee for service, and I'm going away from cell gene therapy, but you know, on the knee stuff, it's like, you know, if they don't operate,
they don't cut, they don't get paid.
That's exactly right. So I mean, there's the wrong incentive.
The wrong incentives, yeah. Well, so why don't we inch away? I think we've covered most of what thing we want to cover on Infusion. Anything that we missed or that you want to touch on before we kind of move away and move up? Okay. So then, you know, back on the subject of sort of Cochran Health Ventures, right?
Yep.
We've talked about 2 companies that you work with today, and you said there's maybe 6 or 7 others. Is there any areas that you have your eyes on as opportunity areas or emerging spaces that folks aren't really thinking about right now?
Yeah, I mean, I would say like there's a lot. And you know, I think part of it is like seeing, like I always talk about like big pillars when I talk with clients. It's like, you know, what are the next 3 to 4 things that you're going to be, you know, focused on? I think oncology is a big one. Early detection. I think direct to primary care is another, you know, massive one. Also like different PBM options that believe in transparency and are doing things, you know, the right way.
You're going to meet one later today.
Yeah, that's exactly right.
Yeah.
So, you know, there's just a lot of these big things, and I would say organizations that are coming at it from like a unique approach. Everything that I've sort of decided to work on, I feel like they've done really, really well in like one market, and they're just trying to reach like a broader audience in like a different category. I think it's important, like, you know, maybe if it was like the greatest company in the world and I like believed in it, I would, you know, be part of it. But I like to see success and case studies and like understand the number so that I'm comfortable bringing it to, you know, the next person. So I think the like stage of organization that I'm getting involved in is they've got some momentum in the market.
Okay, so you're not doing kind of early idea, pre-seed money types of.
No,
okay,
because it's hard.
It's really hard. No, I don't disagree.
Yeah.
So, question for you then: if I am somebody's listening, going, man, I want to work with Dan or I want to engage with Dan, what would you say to them of like who would be the appropriate kind of entity to reach out to you and might be worth a phone call?
Yeah, I mean, I think you know, obviously, like as a independent, I would say like it's easy to create other sort of like relationships with other independents that sort of like help me from, you know, a growth perspective. The counter to that, and like the reason why I wanted to sort of go on my own, is that I realized like I can work with great companies that are innovating, building technologies, but I don't have to be the technology builder. Like I don't have to worry about all the stuff that, you know, is hard about building, you know, a business. And I really just get to help them, you know, from like a growth perspective. But I ultimately think like, you know, I'm only 6 months into this. I think it's been a lot more successful than I even thought it would be. But I think over time, like I will add employees. You know, the best thing I ever did was get a bookkeeper and like things like that to make my life easier.
To make your life easier.
Yeah. But I mean, it's like if people do it right and they learn like under me, I think they really will understand that like I'm in it for my customers, and it's not about like how much money you can make or, you know, closing a deal. It's like, what value did you bring that end client? And to me, that's what's like so exciting. Like when I look back on some of the, things that I've done, it's almost like a sense of being proud.
Yeah,
like,
of course, yeah.
I don't know. So
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
And so, what does healthcare look like for you, Dan, in the next few years?
Yeah, so I'll give two quick answers to that. Like what I would love it to be, and
That's
this
fine.
is way out there, but it'd be amazing if you could, whether it's AI or some technology, you step into a booth, it just scans you, knows here's the list of 10 things that you should improve. And then here's your team to go do that and make you a more healthier person. And whether that happens through technology, AI, whatever it may be, I think that would be, incredible. Where I hope it goes in the short term is the transparency stuff for me is so important. And whether you're looking at medical networks or direct contracting or COEs or bundled payments, all the different mechanisms that people buy through. I just think there's got to be a better way so there isn't so much fluctuation. And
I think it's the sewing it all back together. We talked about Valence earlier as just a good example, as a name of an entity that I believe, and I know Rob well, and I like him a lot and what he's built, is sewing it all together, right? So if you're going to take away the traditional system, give me something that replaces it all, but replaces it in a much better way. And I think they're doing that. They're trying to do that, right? And so I think whoever is best at taking everything that was fragmented and complex, finding the best-in-class solution, and then putting it all back together in a product and a program is going to win the day.
Totally.
Yeah.
Well, and a lot of just because you mentioned Valence, right? So let's take a Buca carrier, and let's say you go to Baylor Scott and White, because I drove past that today, and that Buca carrier gets a 50% discount or whatever it may be. I'm just throwing that out there, so audience don't take that literal. But let's say Valence can get a 70% discount, on a regular basis for a certain procedure, and the hospital's agreeing to it. So it's well, in that case, why do you use the medical network? Because it's less, but the same facilities, they think it's fair and equitable to, potentially offer somebody else a deeper discount. And I just think that's another example on the specialty care thing. We saw a member go to the same hospital. This is a regular therapy, and the same drug, same unit, same everything, and it was 2 different prices, 2 different times, but the same hospital.
Jeez.
And it's why does that happen?
Yeah. How's that even possible? Yeah.
So it's just consistency and understanding, what is fair and equitable, and more for the consumer, because you want to feel even myself, when I started my own company, I needed health insurance. So, you're balancing different things, access, convenience, what is this going to look like for my family? And it's just not easy, to understand what to do. But
well, you mentioned something that triggered a thought when you were talking about that AI scan, and you just go in and it tells you everything. I actually saw, and you take these things with a grain of salt because it's like an influencer doing a reel, but this gal went over to Turkey, and there was this whole hospital system all in one place. And she's like, I went over and got a dentist visit. I got my blood work done. I got my OBGYN stuff done.
Cool.
I got this CT scan. I got an MRI. And she lists stuff that would have cost, $50,000 in the United States and might have taken months to do. She's like, I did it in a day. It was first class, and it cost me $880, right? Yeah. And I didn't get to scrutinize all the details of it, but that's just an example of those things already exist.
Yeah.
They just haven't been put together in an economical way, at least here in the United States. So you might have to fly to Turkey to get something like that done.
Totally.
But it's absolutely 100% possible to deliver.
Yeah. Well, and I guess last thing, my wife, she's had some, health problems recently, and she's fine now. But she was dealing with an endo, a neuro, her primary care, a holistic doctor, and all these different inputs. In some cases, they were disagreeing on a certain medication or whatever it may be. And if you asked her what she really needed was somebody there to just almost like a concierge medicine type thing. It's just help me make sense of all the stuff that's going in, because if you don't have that, like, it is on you. Like, you have to remember, like, what did the neuro say and what does he want me to do? And then compare that to like the endo, and it's difficult. Like, if you are perfectly healthy, you don't have any problems. But the more and more complex you get, and unfortunately in the US, like, there's more and more people with complex
chronic problems, and
exactly. So it just becomes hard. And like what you mentioned, like, it's great. Like, whatever problem you have, walk into this building and there's I don't know if it's like a different door or floor or whatever. Like, it's there.
It literally looked like a mall.
Yeah, it's awesome.
It literally looked like a mall, and you just would walk across the hall, and this one's over there, and it was, I mean, it was luxurious looking as well. And right, again, this is social media, so you can paint whatever picture you want. So I'll take it with a grain of salt. But I don't doubt it as well, right?
Yeah.
That those things are possible. So why don't we do this then, and we'll get out of here and go get lunch and get on to our next thing. But closing thoughts, man. We covered a lot of ground today, but if there's one or two like main things you want the folks to remember, what would that be?
Yeah, I think that I think there's just a lot of like really unique, cool things that are out. Like, one of the things that I struggle with is, now that I'm an independent, like, I can do whatever I want. So it's like, what do I focus on? And, I just think that what's been eye-opening to me in the last 6 months is that there's some like really amazing, great companies out there, people that are worth the time to like work with and understand, what they're doing. And like, networking is just super important. Like, I think the hard part when I think about my buyers, like, they're so stressed out. Like, it's like, I can't look at one more thing, or even if I did want to do this implementation, like, I can't because of IT and all that stuff. But it's like, every now and then, pick your head up off the desk and just like, what else is out there?
Yeah.
And like, is it the right thing for, whatever side you're on, your members or your patients or whatever it may be? Because, that's the benefit to U.S. healthcare, is that there's a lot of new things coming out all the time that are great. And I just think people should pay attention to that. And the last thing that I think really needs to happen is consumers just need to get smarter and like understand healthcare. And I know that's sort of like a challenge to the world, but it's like, understand what an EOB is, understand what your bill is. Like, did it get repriced by a medical network, or did it go to an out-of-network company? Like, I know that's like our world every day, but it's important to understand that type of stuff when you're buying healthcare. And that's what you're doing, is buying healthcare. Like, I think a lot of people, it's like, I have this card, I pay my $20 and that's what it is. Yeah. And it's like, there's so much more behind the scenes that, I just wish more people like understood. So
couldn't agree more, man. Well, that's a great way to end it. So let's kind of wrap it up there. I do again appreciate the effort to be down here. I'm glad we get a chance to do the think tank here afterwards as well, and you get a chance to meet the rest of the crew. But again, thanks for your time, Dan. It's been a pleasure.